The article that I will be discussing today is What's Behind Rising Healthcare Costs. This article is very important because healthcare costs are set to rise or are already rising in 2025 to 2026. And this is extremely important as not everyone will be able to afford this realistically and practically. The premiums for some ACA plans will jump. The article also states, which is very important, that this issue is about rising prices, not necessarily increased usage of healthcare or healthcare insurance. So many Americans get insurance not through employers, but through the ACA. So this will affect many people. So since many people depend on this, aforementioned, the expiration of subsidies and the premium hikes may lead to large reductions in coverage, and this will show in our emergency rooms, our primary care visits. So that's extremely why this article is important. Implications on healthcare delivery, coverage, access. Again, there will be declines in people seeing their primary care providers because the copays, deductions, things will be too expensive. And we have to really start looking at these things. Or I don't know, I mentioned before about like a lack of empathy. I'm not sure like what's not clicking, but how can people, why does it even have to be said that people deserve healthcare? They deserve to see doctors, nurse practitioners, PAs, dentists, the eye doctor. So this will increase the strain on providers and hospitals. As coverage shrinks, more people may rely on uncompensated or underpaid care, or just like going to the ER. This could put financial pressure on hospitals, clinics, and providers, especially safety net providers, serving low income or uninsured populations. It's extremely important. So this will be, or we will start to see a shift or more of a shift in healthcare, utilization. What concerns me the most is the lack of coverage, or even, just lack of coverage, because they're not going to pay for something that they won't be using. So just the lack of coverage and the lack of care that these people will be receiving, or whoever is affected by this, it's really sad. There will be a strain on public health and those type of nonprofit organizations or people who just go out there on their own providing care. There will be a strain. There might be increases. I work on the Malloy community service van, community clinic, and we already see a bunch of people each event. But what if there are increases or an influx of people, since we do blood pressure, we do A1C checks, as well as blood glucose monitoring. What if we start to see way more people? Then we will have to get more services, more students, more money will have to go into the van to get things to provide the community with, because we do also give away items as well. So there will be a deterioration in preventative and routine care, which is just total what's the whole article is about, or my concern is about. What questions remain unanswered? So how many people are projected to lose coverage if subsidies expire or costs become unaffordable? So are there estimates for 2026 and beyond? Because this will affect other years as well. Will insurers lower profits or increase efficiencies to try to restrain premium growth? That's a great question, because will the increases mostly reflect rising underlying costs like the services or the drugs? And will they try to, what will these private insurers' goal be to keep customers? How will different states respond? Because in New York, sometimes we give a lot of pushback. But how will other states respond? And even New York, what are we going to do for the people that are losing health care? We rely on health to be healthy. Humans deserve treatment, care, and preventative, not just going to the ED. So in conclusion, This calls for just a serious discussion on everyone's end, on every realm, throughout every level of government. We have to continue the fight and continue talking about this. I'm not even sure why it has to be a fight or a discussion, but it's not fair for people to be out on the street. We already have issues with housing, food, healthcare. Like, it's too much. And I don't think that as American citizens, we should be going through these things, or, in America.